It has been an incredibly busy year for the National Guard. Give us an idea of the range of things that your men and women have had to respond to in 2020.
Range is the right word. We originally started this response, believe it or not, working with the Corps of Engineers, thinking that we were going to have to build alternate care sites, alternate facilities for hospitals and other healthcare organizations that might exceed their capacity. And that's in the rearview mirror now. We don't even think about that because they've dealt with that on their own. We've put soldiers and airmen in food banks, as you well know, in response to the food insecurity that's occurred as a result of this coronavirus. We have had to put medical staff into nursing homes as a result of surges there, losing staffing due to positive coronavirus tests. We've put medical staff into our prison systems when they've lost medical staff. We've put soldiers and airmen into our prison systems when they've experienced loss of corrections officers due to positive coronavirus. Civil disturbance response in the wake of the George Floyd killings, and the list just goes on and on and on. We have met just about every kind of staffing surge mission that you could possibly imagine, particularly to our state institutions, but also in the case of nursing homes, private institutions, if it's a result of coronavirus.
A lot of people have, in their minds, shifted to thinking about COVID in terms of the fatalities, the infection rates, but we're literally sitting in a food bank right now. There's been this steady food insecurity that's been happening for the whole 7 months, and we forget that.
It certainly has, and in fact, this was one of the first missions to which we responded because the volunteer support for the food banks dropped off to zero almost immediately. When we really learned about what this disease was and who it affected, they realized that their volunteer base, many of those people who are older or who had underlying conditions, it just was not safe for them to come to work to volunteer here. So this is where the Guard came in. And early on, we put almost 600 people in the food banks to backfill for those volunteers that they lost.
And you combine that with a surge in demand.
That's right. That's right. I was on a call the other day with CEOs of Ohio's food banks, and I was staggered to learn, for example, the Cleveland call center, their call volume increased by 7-fold. People calling, trying to find how they'd go about getting food. 7-fold increase in people looking to get food for their families. That's staggering.
And it's not something that makes the headlines. It's sort of there's a certain quiet to it. Perhaps it's the shame of needing help in this way. Perhaps it's, it's not the same as saying, you know what, I've got COVID, and here, socially, we're all talking about quarantining, and here are the steps that you should take. But it's a different conversation. You say, I can't figure out how to feed my family.
That's right. That's right. And one of the underlying requirements for our soldiers and airmen doing this mission is that they treat everyone with dignity and respect. When someone leaves one of our distribution centers, when they come into contact with the Guardsmen, we want them to leave feeling better than they did when they got there. They shouldn't feel shame. This is no different than any other impact of this coronavirus. And we want them to leave there with their dignity and with their respect. And our soldiers and airmen have done a fantastic job with that. I'm reminded of a story that one of our soldiers down in southeastern Ohio told us, a small community. And so the people who are coming through that food bank are people he knows. They're people from his community. Keep in mind, our soldiers and airmen live in the communities with the people they're supporting. And he just talked about the intrinsic strength and value that he got from serving those neighbors and those relatives that were coming through that food bank and doing it in a way that let them leave there with their dignity and with their respect and knowing that this is going to be better when this is all over.
Tell me just a little bit about the scale of the food bank operation here. How many people are you deploying to this? How many people are coming through here?
The scale is just incredible. It's almost incomprehensible. These soldiers and airmen, between the 14 food banks around the state of Ohio, they've packaged over 65 million pounds of food. I can't even comprehend 65 million pounds of food, but that's what's been moving through the hands of our soldiers and airmen.
Are you surprised that the need is as acute?
I knew that there'd be an increase in the need. I had no idea how much it would be. I had no idea how much it would be. Our soldiers and airmen tell us about people who've worked as volunteers at the food bank, who are now coming through the food banks to get food for their families. So that's a 180-degree, social change, so to speak, and it's profound And it's prevalent in our rural areas. It's prevalent in our urban areas. This is not just an Ohio issue. This is a U.S. issue. This is a global issue.
You're going to be here in this active mission of supporting the food banks till the end of the year. Do you think the problem's going to stop then?
I don't. I think we're going to be in this for a while. I think even when we have a vaccine, it's going to take a while for that vaccine to be developed and distributed and put into enough arms that it makes a difference for this disease. In the meantime, we have to keep doing what we're doing. We have to keep the measures in place to protect ourselves, the social distancing, the masks. I will tell you, I fear that we may see worse before we see better. Here in Ohio, we know that we're starting to see some fatigue with coronavirus. That's causing a bit of a letdown in the discipline. We're coming indoors because it's getting cold and we're approaching the holidays. That's kind of a perfect storm for seeing an increase in the numbers for coronavirus. So I think that we may see some greater challenges before we see our way out of this. So do I think there will be a demand here at the food banks for additional help? I don't see the volunteers coming back anytime soon because the conditions haven't changed. And I don't see the food insecurity going away anytime soon. So when you have that increase on the demand side and the challenges on the supply chain side, yeah, I think it creates a need for the National Guard long after December.